Available evidence suggests that in low and middle income countries, there are about 134 million adverse events in hospitals every year. In low and middle income countries alone, adverse events in hospitals can contribute up to 2.6 million deaths, and all of these deaths are due to unsafe care. Patient harm due to adverse events is among the top 10 causes of death and disability across the world. This is comparable to malaria and tuberculosis. Across the world, 7 million people, approximately, annually suffer disabling surgical complications, and some estimates indicate that about 1 million of them die from these complications. As we saw in that slide earlier about the number of encounters before there is an adverse event, there is a 1 in 300 chance of being harmed while accessing healthcare. And finally, 15% of all hospital spending in middle-income countries can be attributed to treating patient safety failures. And this can translate, and some sources estimate this to be several billions of dollars. We have seen how complex and dangerous healthcare systems are. We are probably conditioned to think that anything complex and difficult demands more management, more regulation, more resources, invasive governance. There's almost this undying anxiety in us to do more and intervene when faced with a challenging or complex task. Might we be wrong in this approach? Could less be more? If you examine complex systems in nature, they seem to be self-governing. They follow simple rules, practical rules, and exhibit a high level of adaptation and emergent teamwork. It might sound far-fetched, but there might be lessons to learn from ant and bee colonies, from the flocking of birds, from the schooling of fishes, the synchronized lighting of fireflies. They seem to self-govern and self-organize themselves. There is no apparent hierarchy. These are also very complex systems. In fact, all complex systems in nature seem to be emergent. There is no top-down hierarchy. There is no CEO telling a CEO ant telling a worker ant what needs to be done. The starting point is the acknowledgement amongst various stakeholders that hospitals are complex. That in a system like healthcare, everything ultimately depends on the last mile. That atomic interaction between the doctor and the patient at the bedside. That sacred interaction that we need to empower and enable. And that needs humility. That needs a mindset to adapt and collaborate. Because humility allows us to embrace paradoxes. It allows us to accept dissent and disagreements. It allows us to critically examine our assumptions and always remain skeptical of our methods and processes. Unfortunately, today, many of the stakeholders in the healthcare ecosystem seem to be blind to this intrinsic complexity. In fact, each of these Avengers stakeholders is confident, probably even overconfident, that the other stakeholder is wrong. We have eyes, but we're unable to see. Nobel laureate Professor Daniel Kahneman once famously said, "Not only are we blind, we are also blind to our blindness." This applies very much to hospital systems. Nature teaches us that complex systems are self organized, they're emergent, and based on simple rules. Such natural systems seem to be successful and harmonious. Maybe the way to govern complex systems then is not the way we govern other systems, which is a typical pyramidal, top down hierarchical structure. Because complex systems have porous boundaries and they constantly adapt and evolve with other subsystems. And because these subsystems and components operate based on rules that are not clearly defined or adequately understood, we must seriously consider if less is more, and then enable and accentuate this intrinsic property of a complex system so that we can guide the hospital in a more favorable direction. Fortunately, there are some real world examples that we can turn to for inspiration. And in the meanwhile, we should probably learn from Mother Nature and resort to humility. And remember and seriously consider if less is more. Let us now look at these practical examples that are available to us and see if some of them can be applied in hospital systems.